As we get older, our vision changes. Unfortunately, not for the better.
Yes, squinting now. One of the biggest problems we face is cataracts. They're the leading cause of preventable blindness worldwide, but a breakthrough new laser could change the way surgeons fix the problem. Fox Medical Team's Beth Gallen is here to explain. Beth?
Well, Lisa and Russ, when you have a cataract, if surgeons want to take it out, first thing they have to do is get to the lens. And for a long time, they've used their hands to make the incisions in the eye to try to reach the lens. But a new laser could take some of the guesswork out of operating on your eyes.
Just watch that blinking light.
Here at Gainesville Eye Associates, a new way of treating a frustrating old problem, cataracts.
Oh, this is huge. We have not had an advancement in cataract surgery for at least 25 years.
By the time we're 60, most of us will have developed a cataract, which is a clouding of the lens of the eye. And that blurs our vision, so it's kind of like looking through a foggy windshield. The only treatment is to take the cataract out with surgery. But first, you have to get to it.
Up to this point, we've had to have manual incisions, which we cannot reproduce the exact same incision.
But a new laser called the LensX can do what even the most skilled eye surgeon cannot. Bladelessly make the same cuts in the surface of the eye every single time.
The precision is what's incredible. Degree by 1.1.
Dr. Jack Chapman and his colleagues are the first ophthalmologists in Georgia to have this new laser. And it uses LASIK vision correction technology to take some of the guesswork out of cataract surgery.
The human hand cannot make an incision like that. It is so precise.
And Dr. Chapman is so sold on this laser, he's willing to have it used on his own eye for this.
This is it right here. You're seeing it. This little wedge is sort of kind of coming up right in there.
Recently, he started developing this cataract, which was starting to blur his center vision.
He will be one of the pioneer patients, to have this operation done.
So Chapman has asked his partner, Clayton Blam, to take the cataract out with the help of the new laser.
I'm excited. To me, it's an honor that a colleague would trust you enough to perform this surgery.
But no nerves here.
I know the capabilities of my colleague, what he can do, and I know the capabilities of the machine, and so I'm perfect with it.
So after performing 18 surgeries in the morning, just after lunch, the doctor becomes the patient.
I'm going to get on a stretcher and lay down and become a patient. My eye's going to dilate. They'll get an IV in me.
Once Dr. Chapman is lightly sedated, his eye numb so he won't feel any pain, he's rolled into the operating room where Dr. Blum is waiting. First, the laser measures the thickness of his lens.
All right, we're ready to treat. We're going to get started. 35 more seconds. It was perfect.
It's all over in about 30 seconds.
You're done.
And after a trip into a second operating room to section out and remove the now fragmented cataract, a thumbs up from the doctor turned patient, who is now cataract-free. You can see he looks a little sedated still there, fresh out of the operating room. And right now, the LensX is not covered by Medicare or private health insurance providers, but the cataract removal part of the procedure is. The laser will cost you anywhere from about $1,500 to $3,000 more, depending on what type of artificial lens you have implanted once that cataract is removed from your lens.
Wow.
30 seconds?
That's incredible.
30 seconds. I mean, the whole thing, both surgeries, they're over probably in about 10, 15 minutes. It is pretty amazing what they can do with eye surgery.
Life-changing.
Really? I mean, you know how the king used to have the cook eat the food so they knew it wasn't poison? When the doctor does the procedure,
Yeah, you
right?
gotta trust him.
Yes, that's truly trusting your colleague.
There you go.
Thanks, Beth.